Rao, Senior Consultant Cardiologist. Where is my introductor? Thank you very much for your nice introduction in a lovely language. Thank you very much. So as you all know that how many of you people heard about heart attacks? Can you raise your hands please? Only one pharmacology college. That's great. Please raise your hands straight to 90 degrees please. Female hormones that protects from them heart attacks. That is a God gifted for them. But in the olden days, the female used to get the menopause around 50, 60 years. But nowadays, with 35, 45 years, also I have seen many patients suffering from this perimenopausal syndrome and menopause, suffering from menopause. That itself were very big risk factors in the females. But never think that females will not get a heart attack. I think females also have a heart, so hence they will get a heart attack. Any females have a right? Please raise your hands, please. Only one female. Only one female having heart here. Oh God. Okay, right, good. So, in coming to the topic of the gender, a non-modifiable risk factor that both the genders are equally affected, but no idea about for me the transgenders. I have not seen any case till today, and no books have been documented of suffering from this heart attacks. I don't know the reason, whether they are not coming to the hospitals or we are lacking for something else where we have to work it out on this. Transgenders I have not seen any case, even though very rare few patients only have seen the transgenders. But think that males and the females both are equally affected. That is called as again a one risk factor of non-modifiable, where we cannot modify it. And the third one is a strong family history. This is also plays an important vital role. That means it is not that everyone should suffer from a heart attack, not like that, but it is a cautious warning that we should be careful. If, for example, if my grandfather or his father is suffering from a strong family history, or if my father is also having from a history of heart attacks, it is very high alarming for me about these heart attacks. Now we have very good investigations about this. From the saliva, we can find out this hereditary cause, and we can find out the risk assessment when we come to the rehabilitation as we discussed. So in that we take the strong family history, risk stratification. So we have the different investigations now. So strong family history plays also a big vital role as a non-modifiable risk factors for these heart attacks. And next, ethnicity, much more importance about that. And infections. Just now we are talking about the infections, about the COVID. COVID does not cause, to my knowledge, the heart attacks. That is only a bullshit. That's it. But any infection, the bacterial infection or the viral infection, which are very much responsible in increasing the CRP levels. Can anyone knows what is the CRP? C-reactive protein. Yes, what it does? From where it come? From a bucket. So CRP is a protein enzyme which comes from the liver based upon the infectious levels in the body, either the virus, either the bacterial. So because of this high infectious rate, there will be the edema. Can anyone tell me what are the cardinal signs of inflammation? Ruba, Cala, Do, Pala, and functional ulcer, right? They are the 5 cardinal signs of any inflammation. In that inflammation, the important thing is edema. So there will be the intimal edema of the arteries, by which the size of the lumen comes down. This causes the angina and may lead into the heart attacks. But no, COVID is not only a risk factor for the heart attacks. Please kindly remove from your minds COVID is a risk factor for heart attack. That is not at all a risk factor for heart attacks. It can be occurred by any bacterial infections or the viral infections. Okay, next slide. Now, this is very, very important for your young generation. Some large benches or some junk fruit. Okay, now we have come to this modifiable risk factors. Now, what is this modifiable risk factors? Much where we can rectify ourselves, where we can treat ourselves, where we can restrict certain things ourselves in preventing or in not getting the heart attacks. In which the first important thing is the blood pressure. We call it as a hypertension. So blood pressure is very, very important for causing the heart attacks, because the heart attacks forms in two ways. One, there will be a plaque formation in the arteries. The plaque formation nothing but unwanted cholesterol like LDL cholesterol starts of depositing, accumulates with the calcium. It forms a small hump, that's just like hump in the artery. So its size of the artery get reduces. Once this plaque rupture, because of high blood pressure, this plaque get rupture. Once it get rupture, there will be the internal bleeding. To come out from that internal bleeding, a thrombus forms by which the blood flow will stops. That is the reason why blood pressure should be corrected, should be modified. That is called it as a modifiable risk factors, where we can get a good treatment and we can come out from these heart attacks. So blood pressure is the risk. Why? Because it ruptures the plaque and causes the heart attack. Next is the diabetes is another vulnerable disease in India, because three important diseases are vulnerable in India. So that is what is blood pressure, diabetes and high cholesterol. These three important diseases are main responsible for getting or making us to get suffer from these heart attacks. So diabetes, what happens in the diabetes? In diabetes, what it happens, the cholesterol levels increases. Cholesterol level increases in the diabetes. I will give a very good treat if anyone can give the answer for me. What are the main reason for forming the cholesterols? This is formulas, people should answer this. Very good. Which oil? Saturated and saturated. Saturated oils. In saturation also we have a long chain, intermediate chain, short chain. Which one are good? Short. So coconut oil comes under which category? Pharmacy people should answer this question. Really? But in that also we have the short chains, medium chains, small chains. Okay. So our topic comes to the diabetes. The main cholesterol is not because of oils. Please remove from your minds that oils are not at all risk for these cholesterol formations. Please remove from your minds. The sugars are main responsible for the formation of cholesterols. That is the reason why in diabetes, usually more of the individuals suffers from the high cholesterols, especially that we call as a triglycerides cholesterols are high in the diabetic patients, which is essential for the formation of the plaque and deposits with the mixed deposits with the calcium causes the problem. That is the reason why diabetes is a modifiable risk factor for getting heart attacks. Diabetes is also treatable disease. Diabetes is also a treatable disease. Blood pressure is also a treatable disease. And these diseases are reversible. Please make a point, all the students. Diabetes, blood pressure, cholesterols are reversible diseases. Please make a note. Yeah, all these diseases are reversible. So this is how diabetes have become one of the modifiable risk factor. Now the third thing is high cholesterols. In high cholesterols, we have different type of cholesterols. One is called as a total cholesterols. We have the triglycerides. We have the HDL. HDL means high density lipids. We have LDL, low density lipids. We have VLDL. Among these things, HDL cholesterols are the good cholesterols and LDL cholesterols are the triglyceride cholesterols, or we so call it as the bad cholesterols. But you never mind that cholesterols are very, very, very essential, required energetic product in our for our life. Can anyone tell that with cholesterol, which organs get function? Why the cholesterols are important? We need carbohydrates too. Proteins also we have. But why I am talking and why I am stressing only on the cholesterols?
Flexibility of cell membrane.
For synthesis of vitamins.
You're right. See, for the brain functions only by the cholesterols. If there are no any cholesterols in the body, brain stops working. Remember that. And the sexual organs, like a male, if you have the testes, in the females, the ovaries, which are very much responsible for the infertility and the fertility mechanism. Cholesterols are very important, otherwise there is no any mankind production. So cholesterols are not much high responsible. Everyone having their own normal values. If I ask me, mine may be 250, yours may be 300, his may be 120. But in fact, the cholesterol has to be reduced to a maximum extent, but not the below abnormal the values. We should have some high cholesterol. If you go into the Western countries, if you see the 80 years, the 90 years, 20 years, I have seen when I was in UK and Italy, they were having the total cholesterol of 600, 700, 800. But why they have not suffering from a heart attack? Again, the exclamation and question mark, both we have come. So in that, again, if we see, the LDL cholesterol is important and the HDL cholesterol ratio is important. If we have the high HDL cholesterols and the low LDL cholesterol, the risk factor is very, very, very less. If it is reverse of having a high LDL and low HDL, the risk factors are very high in forming the plaque. So this is why the cholesterols also have become one of the modifiable risk factors for getting the heart attacks. So these are three important vulnerable diseases, and which are also reversible diseases. Blood pressure, diabetes, cholesterols are reversible diseases. Please make a point. These three diseases are reversible. And the important thing is, now we come to the obesity. Nowadays, आजकल छुट्टी मैडम बोल रही थी, बिल्कुल कल छुट्टी है कॉलेज, चलो भाई कल छुट्टी है, 6 बजे सो जाएंगे, रात 10 बजे उठेंगे. This is the trend what we follow. All interests, am I right? कल छुट्टी है, चलो सो जाओ 12 बजे तक. But how many of you knows that if you sleep more than 7 or 8 hours, your body get weak? Can anyone knows about this? If you don't know, please make a note that we should sleep as much as we need, the minimum of 7 to 8 hours only. If you sleep beyond 8 hours, 9 hours, 10 hours, 11 hours, your body muscles gets weak. You looks very older at the age of 20, looks 40. Anyone is here looks at the age of 20, 40 years? No one? If you sleep properly, not more than 8 hours, even if you are 60, you look to 40. This is very, very important. तो आप 12 घंटे सो जाएंगे या चलो 14 घंटे सो जाएंगे, 18 घंटे सो जाएंगे. But remember that your body muscles gets weak. Have you experienced, madam, in your practice? Have you studied some patients when you come across in UK? So sleep more than, if you sleep 8 hours, body muscles gets weak. If you don't do any exercise more than 24 hours, your body muscle power will come down about 3%. Remember that 3% muscle power will come down if we don't do the exercises. So lack of exercises and going into the sedentary life, which leads into the obesity. Obesity again is itself a risk factor for blood pressure, for the diabetes, and getting in high cholesterol. That is the reason why obesity have become one of the risk factors for the heart attacks and have become one of the modifiable risk factors. And another important good things here for all young generation, girls and boys, cigarette smoking, tobacco smoking, तंबाकू. कितने लोग तंबाकू यहाँ पर है? तंबाकू, please raise your hands. For cigarette, cigar. I believe that most of the people smokes here. Most of the people smokes here, because I was seeing on the roads, even the 11th standard, 10th standard coming and they're sharing one cigarette among three. This is the one of the main important reasons why these youngsters are suffering from the heart attacks is the smoking. You all the parents who have your children, this is the again a responsibility, a private responsibility of the parents of not having an eye on their own children. Most of the people, I am seeing that most of the people, if we come to the detail industry, there is a history of smoking, of one puff or 2 puffs or 3 puffs, it is there. Even during my MBBS ragging, I have been experienced of smoking gold flag cigarette. Which cigarette you smoke? What's the time pass?
Advance.
Advance. Okay. So, so remember that smoking is one of the very important risk factors because of nicotine, which presents in the tobacco, which causes severe vasoconstriction, by which the blood pressure increases, by which the tobacco is one of the major risk factors and become a modified risk factors for these heart attacks. And another important thing is alcohol consumption. How many people have experienced alcohol here? Please raise your hand, girls and boys. Alcohol is also, Uncle Ji, aap bolo. Please raise your hand. Okay, come. Madam, how many times you experienced alcohol in UK? I've experienced alcohol in the UK because my sister says, Dr. Rao, Matthew, doctor have come for the rounds, please. I'm going with Dr. Matthew. Can you wait for some time? Shall I bring a glass of beer or coffee for you? That is that culture. That's quite common. So alcohol is one of the major role of getting the heart attacks because of how many of you, the pharmacy students starting from the D Form, B Form, M Form and PhD knows that unwanted calories of energy we get through alcohol. One peg of alcohol, one peg of whiskey or whatever the things, it gives around 200 kilocalories of energy for us. This is literally a unwanted. This is the reason why alcohol has become one of the major risk factors. If you have a 2 drinks or 3 drinks, 600 calories of energy we are getting with an alcohol unwantedly. That is the reason why the alcohol. And what happens, this alcohol, this unwanted energy, again it converts into the form of fats and get deposits and cause the blocks. That is the reason why alcohol have become one of the important risk factor for this heart attacks, what we call as a myocardial infarction. And the physical inactivity. This is one of the major modifiable risk factors. How many hours of exercise do we need actually in a day? Can anyone please? 45 minutes, how many? Raise your hands. 30 minutes, how many of you? Raise your hands. Totally only 4, 5. See, minimum, if can you have a normal walking of around 20 minutes with a normal simple physical exercise of 10 minutes to a total of 30 minutes per day, it is a mandatory for us to outcome off from this vulnerable disease of heart attack, and also helps in preventing from this blood pressure and the diabetes and the high cholesterols. So minimum what's the physical inactivity. So never sleeps. Just now I have told you that if you sleep more than 8 hours unwantedly, unnecessarily, we are making our body only into a weak category. Never make your body into a weak category because of this unwanted sleep. So physical activities are playing an important vital role for a heart attack. So we need minimum of 30 minutes of physical activity. It is compulsory. So these are the few important modifiable risk factors for heart attacks. Here the important thing, this is what we are discussing just now, the approach to the patient, how a heart attack patient comes, how we can say that this individual is suffering from heart attack, how this female is suffering from this heart attacks. This is a very important things where each and every person should know about this thing. If I could have been advisory board member of any educational institute or any university, I was just planning and working about this. We needed syllabus on the heart attacks in all professional or non-professional courses. This we should include. I think you, the faculty, at least on behalf of your side, you can make include this topic as per at least for internal topics and internal exams. This is place important because everyone should know, because this World Health Organization theme is my health is my right. So when is your health is your right means your responsibility to learn about the heart attacks also. Pink t-shirt with that, right? What right? Next left. So this is very important from start. Everyone should have a basic idea, because not only your own health, you can also help in preventing your friends or your relatives or your neighbors in the college also. It's very important where you should, at least you should know how to see the pulse. How many of you know that to see a pulse? Very good, only one hand. Pulse कैसा देखना चाहिए? Please fully raise your hands. Is there any difference between the pulse rate and heart rate? Is there any difference between the pulse rate and heart rate? Sometimes we call heart rate, sometimes we call the pulse rate. Is there any difference? Pulse you can feel by your fingers, whereas the heart rate you cannot feel by your fingers, where you need an equipment is called a stethoscope. Both are same. When you have a beat, generally we have the pulse, but this is the difference, that where manually we can see the pulse, you can feel your pulse very comfortably, but to know the heart rate we need the stethoscope equipment where we can hear the heart sounds. Okay? So now how this patient presents here? Here also we'll categorize in two ways. One is called as atypical symptoms. Next we call as the typical symptoms. What is atypical symptoms? Atypical, we are talking about the heart, right? In that we are talking about the heart attacks. Means the patient should come with the presentation or with the symptoms about the heart. And atypical means the symptoms which are not related to the heart. But even though the patients are suffering from the heart attacks, and you might have experienced that, you might have heard that, अरे अब तक ठीक था, अब भी 1 घंटा तक मेरे से बात करके गया, रात में 11 बजे he died. And you might have experienced that, अरे ये पेशेंट जो है ना छाती में जलन बोल के आया हुआ है, सोडा पिया तक बोल के मर गया. एंड ऐसे भी सुना होगा कि अरे ये अभी नाच रहा था, बहुत मस्त नाच रहा था, सडनली मर गया. You might have heard, no? You might have experienced these things. So here, let us make you a small introduction. These heart attacks are different. Again, sudden cardiac arrest are different. Both are not same. Heart attack is not same of the cardiac arrest. Cardiac arrest is not same of the heart attacks. Both are different. Both presentations are different. Sudden cardiac arrest, which will not give you not even a single movement of second, where we will collapse immediately. That is a different way. But now your topic is about the heart attacks. The atypical symptoms are those important is that patient never comes with the heart symptoms. Important thing is some patients will experience severe nausea, severe nausea and vomiting. Suddenly he starts of getting in nausea, and he suddenly starts of getting the vomitings, or sometimes he gets of a retrosternal burning pain, a typical symptoms of an hyperacidity. So we call as the gas problem hua, gas trouble hua, acidity hua. These are the very important symptoms where you should not do any negligency. You should not neglect these atypical symptoms. That is called, the first is the nausea and vomitings. Most of the patient with presents with atypical sort of severe nausea, vomitings, or severe upper epigastric pain. This side the patient comes with the pain. This is called epigastric pain. This is a very atypical presentations where the patient comes. Some patients are associated with profuse sweating, आईसी कोल्डनेस ऑफ बॉडी. अगर पेशेंट कोई भी अगर चेस्ट पेन की जरूरत नहीं है, अगर पेशेंट का बॉडी पूरा ठंड पड़ गया, आईसी कोल्ड हो रहा है, टेम्परेचर ड्रॉप डाउन हो रहा, यू शुड गेट इन योर माइंड दैट दिस मास्टर माइट बी सफरिंग फ्रॉम हार्ट डिजीज. This is very important. Whether he might be suffering or not is a secondary issue. But if he is having this problem, if you take to the hospital and have an ECG, we definitely save his life. Yes or right? So this is the reason why in atypical present, अरे ये गैस्ट्रिक ट्रबल है बाबा, इसको एक सोडा पिला दो, इसको एक थम्स अप पिला दो, इसको पेप्सी